burden of cancer care is really high globally, and of course at national level, where many people have been struggling and suffer from cancer. And in terms of incidence and prevalence, we see that there are many increasing cases. And as we know, cancer care is quite for a long period of time, right from the time of diagnosis. And therefore, among the things that we explore from a scientific perspective, we want to know when you talk about out-of-pocket expenditures, you see these are expenses that people meet way beyond, actually for some people refer to them even from their disposable incomes. But we know that not everyone is employed. So we sought out as a team to examine and understand the impoverishing as well as the catastrophic health expenditures that are made by cancer patients. Government can create a model where we can have subsidies or provide insurance support where possible.
We found that on average, patients are spending about 300,000 Uganda shillings per visit on cancer care. What this shows is that there's a lot of money being spent by patients out of pocket on cancer care, and we need to devise mechanisms of reducing the average cost of cancer care to the patient. And some of these measures that we're recommending, of course, is decentralizing cancer care, ensuring that we have cancer care centers within the communities. In this study, we found that 90% of patients incurred costs on transportation to the Cancer Institute. And this means that if we can take cancer centers to the community, the cost of transportation will be less.
We have about 300 cases per every 100,000 population. And then in terms of mortality, it's still very high. We are at about 80% of cancer patients, when they're diagnosed within 1 year, they die. And then when we are talking about prevalence, that means the number of people who at any one time in the country are expected to be having cancer, we are talking about in the range of between 70,000 to maybe 100,000, which is quite sizable, given that about 80% of all the new cancer cases actually do die. So that means cumulatively we still have quite a big population of people with cancer. And that is why this study is very important, because it is showing us that in the population, what is the take of cancer on the resources that our people have. And I think it is very clear here that, for those who do have within their families or within their population diagnosis of cancer, the expenditure that they incur because of that diagnosis is very high, and it is crippling economically to the population.